The British finance minister says the UK will not be entering a recession this year.
The positive news comes as Britons grow increasingly concerned about the UK economy and their job security in the months ahead. Several protests are underway across the UK right now. They include a teachers' strike, a transportation strike, and a civil servants demonstration. Tens of thousands of junior doctors are also participating in a 72-hour walkout.
Joining us now from London is Dr. Sumi Manirajan. She is the Deputy Co-Chair of the Junior Doctors Committee. Doctor, thanks very much for being with us. So for those of us here in the United States, what exactly is a junior doctor and why are they protesting there in the UK? What are they asking for?
Thank you so much for having me on the show. So a junior doctor is any doctor that hasn't finished training but is post-degree qualification. So this can take any amount of time, over 10 years sometimes, for a doctor to become an attending or an attending equivalent here, what we call a consultant. So what's happened over the last 15 years in the UK is that our pay has been eroded by 26%. So a doctor is being paid 26% less than they would have been paid in 2008 for the same, if not more, work than they were doing back then.
Well,
what this has led to.
Sorry, I was going to say that's something I think that all of us here can understand. But it's also complicated because we've also seen ambulance drivers and nurses also take part in strikes over pay. What does all of this mean with the junior doctors, the nurses, the ambulance drivers for the UK's healthcare system? Are there fears that this type of action is actually meaning that patients are suffering?
So at the moment, there is a lot of unrest within the healthcare system because lots of workers have noticed and really feeling the pinch of the cost of living crisis. But the effects on the pay for junior doctors has been going on for the past 15 years. So what this has actually meant is that we've lost 9,000 doctors. We're 9,000 doctors short from the workforce. We're really seeing junior doctors leaving the country to go to other countries such as Canada, Australia, New Zealand for better pay and better working conditions. And that means that junior doctors here have no option but to strike to hopefully bring the government to the table. And we're seeing nurses, paramedics also do the same because they have also experienced a real terms pay cut.
All right. Dr. Sumi Manirajan, thank you.
Thank you.